Hi everyone, welcome to my channel. I'm Mrs. Ezine and today I'll be lecturing on the topic health psychology. Don't go anywhere. So if you're new to my channel, this channel is all about helping students to succeed in the university. That means I give tips, advice on how to make your journey through the university an easy one and for you to come out with a high GPA. So head over to my channel and go through the educational videos I've already posted, and if you would like to watch more, just hit that subscribe button and click that notification bell to be notified of new posts. Now for today's lecture, this video is particularly made for public health students. I'll be lecturing on the topic health psychology for the course Psychological Basis for Health Behavior and Change Process. Now if you are not a public health student, I advise you can still watch this video to gain more knowledge on the topic. Now let's head over to the lecture. So for today's lecture, if you are just joining us, you can head over from the link in the description box below to click on the first lecture to watch the first lecture for the course Psychological Basis for Health Behavior and Change Process. Okay, the link is in the description box below, or you can head over to my channel and click it there. Now for today's lecture, we'll be looking at health psychology. Okay, so what do we mean by health? First, we are going to break it into two. We have health psychology. So what is health? Then we'll look at what is health psychology. Now, the most universal definition of health by the WHO as of 1948 is that health is a state of complete physical, mental, and social well-being, and not just the absence of disease. Okay, you can't just say, okay, this person doesn't have malaria and so the person is completely healthy. No, you have to check if the person is physically okay, mentally okay, as well as socially okay. Okay, so if you look at the definition, it compasses of three specific dimensions. You have the physical, the mental, and the social dimensions, but we can also add the spiritual and emotional aspect as well. Now, looking at each of the dimensions, we have the physical health. Now, physical health is concerned with what we can see, the part of the body that we can see, the anatomical. Now, the physical health is concerned with the anatomical integrity and physiological functioning of the body, the part that we can see. Okay, so it means the ability to perform routine tasks without any physical restriction. For example, you can go for exercise, go from one place to the other. That is for physical health. Now for mental health, it has to do with the brain, the mind, the ability to learn and think clearly, coherently. So if the person is not mentally fit, the person will not be able to learn at a very, very fast rate or at the normal rate compared to someone who is mentally fit. Now the next one is social health. This is the ability to make and maintain acceptable interaction with other people. How are you able to communicate with other people in your environment? For example, celebrating during festival, mourning with close family that died. Some people are not able to do that, so they are not healthy socially. Emotional health is the ability of expressing emotions in the appropriate way. For example, if you are afraid, you express what? Fear. Okay, so the response of the body should be congruent with that of the stimuli. Emotional health is related to mental health and includes feelings. That is why it's kind of under mental health. So it has to do with the mind and the emotion. Now, spiritual health, has to do with, some people classify it with religion. Okay, it has to do with religion. For some other people, it has to do with their personal values, beliefs, and principles, a way of achieving mental satisfaction. So it has to do with their spiritual well-being. So these are the dimensions of health that we have. Okay, so let's look at the meaning of health psychology. According to Joseph Matarazzo, in 1982, he defined health psychology as the aggregate of the specific educational, scientific, and professional contributions of the discipline of psychology to the promotion and maintenance of health, the prevention and treatment of illness, the identification of diagnostic and etiological correlates of health, illness and related dysfunction, and the analysis and improvement of the healthcare system and health policy formation. Wow, it's a mouthful. Okay, what he's trying to say is that health psychology has to do with how the biological, physiological, environmental, and cultural factors are involved in physical health and the prevention of illness. Okay, is that branch of psychology that studies that. It is devoted to understanding psychological influences on how people stay healthy. Okay, it looks at the mind. It has to do with how do people stay healthy, what influences them psychologically, mentally, okay, why they become ill and how they respond when they get ill. Okay, you look at sick row behavior, even wellness behavior, all that is under health psychology. Okay, so the next one, factors affecting health. Physiological psychological factors that affect health directly. For example, chronically occurring environmental stressors which affect the hypothermic thermic pituitary adrenal axis. Cumulatively can affect our health. Okay, so the next one is behavioral factors. Okay, like I mentioned, sick row behavior and wellness behavior. Okay, so we have behavioral factors can also affect our health. For example, people that smoke, over time it can lead to lung cancer and the person can die if not stopped or prevented. Now, also enhancing health, has to be wellness behavior, exercise, drinking water all day, staying hydrated, and all that are behavioral factors. Now, health psychologists take a biopsychosocial approach. Now, just break it down. We have bio, that's biology, psycho, that is psychologically, and social approach. Okay, so in other words, we health psychologists understand health to be not just the product of biological process. For example, when you have malaria and you have the malaria parasite causing malaria, no, it's not just it doesn't just have to do with the biological process, but also of the psychological process as well, including people's thoughts, beliefs. Remember we talked about emotional health as well, and behavioral health. Some people don't really cut their fingernails and so they gather germs, and some people even go ahead to bite their fingernails, putting germs into their body system. And we have social processes as well, socio-economic factors, government policy, regulations, that is nature of living area. People that live in the village have a different behavior to people living in the urban areas. So all this can affect our health. Now, who are health psychologists? They are psychologists who strive to understand how these biological, behavioral, and social factors influence health and illness. These people are known as health psychologists. Of course, they study health psychology. Now, they use their knowledge of psychology and health to promote general well-being. General, not just physical, but physical, mental, and social well-being, and understand physical illness. They are specially trained to help people deal with psychological and emotional aspects of health and illness. Now, understanding these psychology factors that influence health and constructively applying that knowledge, these psychologists can improve health by working directly with individual patients or a group, or indirectly on a large scale, like we have in public health. We will get to see public health psychology as well. Now, in addition, these health psychologists can help train other healthcare professionals like us, yes, public health officers like us, to take advantage of the knowledge the discipline has generated when treating patients. So it helps doctors, nurses, other health workers to really understand the whole being healthy means. So health psychologists work in a variety of settings. They are not just say only in the hospital, okay? They can also work in public health departments on a large scale behavior change, and also on health programs as well, and in schools, university, medical schools. They can teach and also conduct research. Now, health psychologists work with many different healthcare professionals. We have physicians, dentists, nurses. Remember that total health or complete health, like I say, is not just physical. So it has to do with the psychological aspect as well. So they can work with people on a one-on-one basis, in groups, as a family, or at a larger population level. For example, now, if something occurs to one person, an individual in a family, you won't just judge or look at that person health. You will look at how the family also influences that person, and so you can set up a group meeting and talk to them and get to discover the psychological factors that affect that person's health. So health psychology, like other areas of applied psychology, is both theoretical and applied. Okay, it's not just words or something we read, it's actually applied in the field. Now, health psychologists employ diverse research methods. They use methods like controlled randomized experiments, quasi experiments, longitudinal studies, cross-sectional studies, case control studies, like other research, to find out what actually affects us as human beings psychologically. Okay, so health psychology study a broad range of variables, including cardiovascular disease, smoking habits, religious beliefs, social support, living conditions, just external factors, basically how they affect us, affect our health psychologically. So some health psychologists even treat individuals with sleeping problems, headaches, alcohol problems. Other health psychologists work to empower community members. Basically, they can work anywhere, so to say. They can even work in offices to help promote the health of workers in that office. So they improve quality of life in general. Now, what are the aims and objectives of health psychology? Now, number one is that it aims to understand behavioral and contextual factors. We have talked about this. Prevention and treat illness, also promote health and maintain health. For example, now they may help people to lose weight or stop smoking. Yes, some people is due to environmental factors that that encourage them to smoke. So if you can treat that or tackle that factor, it can actually stop that person from smoking. Critical analysis of health policy, improving adherence to medical advice. Yes, some people, you give them medical advice and they don't take it, probably because they don't really understand the implication on their health. So if you can get them to understand it, then they can keep to it, and in that way you can promote health. Improving doctor to patient care, for example, advising doctors about better ways to communicate to their patients. Okay, some doctors don't really know how to break it down for their patients, especially Nigerian doctors. They like using big words. Okay, they like using big words, and some patients don't really understand, especially if you are talking to someone living in the rural area. You can go ahead and say, okay, instead of using English, you can speak to the person in Igbo or in their local dialect. Okay, so it also helps in managing pain. How is that? Through cognition. If the why of the pain is known, management becomes what? Easy. Okay, so let's move on. We have different branches of health psychology, and we have, first one is clinical health psychology. Of course, this has to do with the application of scientific knowledge derived from the field of health psychology to clinical questions that may arise across the spectrum of healthcare. Okay, that is like the medical aspects. Now we have the community health psychology. From the word community, you should know that it has to do with community factors that contribute to the health and well-being of individuals who live in what communities. Now it's not just looking at one individual, it's looking at a group of people, it's looking at the community. Give the example of community beliefs such as women who put to bed at home are stronger than those that go to the health center. Just imagine, some people believe that if you give birth to home, at home, give birth to your child at home, you'll be stronger than someone who goes to the health care center. Just like they believe that people who give birth vaginally are stronger or are better than people who give birth to cesarean operation, which is so wrong. Cesarean section operation, okay, which is so wrong. That belief is so wrong. For example, a woman who gave birth in a G.P.A tank, children not eating eggs, all that beliefs, if you smash that, you cancel it, people's health will improve. Okay, so that's one is under community health psychology. Now we have public health psychology. Now this one is population oriented. Okay, it's not just a small group of people but a large group as well. So its major aim is to investigate potential causal links between psychosocial factors, that's psychological and social factors combined, and health at the population level, not individual. Now as a country, as a nation, sorry, as a state, as the whole world globally. Okay, so public health psychologists present research results to educators, policy makers, so that they can make the right policy, and healthcare providers in order to promote what better health. Now we have critical health psychology. This one now is concerned with the distribution of power and the impact of power differentials on health experience and behavior, healthcare systems, and health policy. So it prioritizes social justice and the universal right to health for people of all races, genders, ages, and socioeconomic position. Now the major concern has to do with health inequalities when it comes to this particular type of branch of health psychology. The critical health psychologist is an agent of change, not simply an analyst or a cataloger. Now the leading organization in this area is the International Society of Critical Health Psychology. So they go ahead and look at health inequalities among other things. Now health psychology has one related field also known as occupational health psychology, and there are other branches as well. You can go ahead and research more on it. Now we have professional organizations under the field of health psychology. Number one, we have the division 38 of the APA. We have been hearing about APA. It means American Psychological Association. Okay, so now we have the division of health psychology of the British Psychological Society, and we have the European Health Psychology Society as well. Now what are the main areas of health psychology? Now the main areas of health psychology include stress and coping. It has to do with the psychosocial determinants of stress and how these factors actually affect our coping lifestyle. How do you cope when someone dies? Okay, someone close to you dies. Now we have health behaviors. I've said this. We have the secret behavior, wellness behavior, and the rest. So it deals with health psychological theories relating to why we act in various healthy or unhealthy ways. Then we have issues in healthcare. This has to do with complexities of dealing with chronic and terminal illness, and psychological factors that influence the interactions between doctors and patients. These are the main areas of health psychology. Okay, now how do we apply health psychology in research? It researches psychological aspects of behavior which are really relevant to our health, and it also applies in the psychology concepts and knowledge to problems arising in health system. What are the problems arising in health system? How to improve patient care, for example. Okay, so you check how psychology concepts and knowledge can actually improve the health system. Now the third one is to teach relevant psychological material to non-psychologists like us who work within the health system. Terminologies, we have different terminologies that you have already been hearing and you still hear as time goes on in our lecture. Okay, number one, the mind, the totality of consciousness, conscious and subconscious mental process and activity. Behavior, how someone behaves, for example. Okay, it has to do with the internal and external responses to the internal and external stimuli. We have emotion, we have talked about this. Disease, which is the abnormal condition of a human. Disorder has to do with a physical or mental malfunction. Psychosocial has to do with psychological and as a social aspect. Okay, if you hear psycho, you just know that it's psychological. If you hear the other one, bio, you know it's biological. Okay, mental health has to do with one's emotional well-being. Okay, then conscious is the part of mind that is aware of itself. Subconscious is part of mind that is not consciously perceived. We have health behavior. You have heard me say this over and over again. So it has to do with the actions that an individual engages in that affect their health, whether positively or negatively. Okay, whether it's eating a balanced diet or smoking or watching TV for 24 hours is unhealthy. So we have sick row behavior. This is the activity undertaken for the purpose of getting well by those who consider themselves ill. So if you are ill, how do you behave during that illness towards getting better? That's sick role behavior. We have personality, what makes up a person distinct from the other. We have intervention. We have health promotion, which is the process of enabling people to increase control over their health and its determinants. And that's what basically we are trying to do using health psychology. Okay, we have population, and target population is the group of individuals that the intervention intends to conduct its research and draw conclusions from. We have community health, which is focused on people's well-being in a particular geographical area. Like I said, we have Umuahia, we have Okigwe, we have Uturu, places like that. Then we have socio-cultural. You have seen social, so you should know that it has to do with the society, with the culture. Cultural has to do with the culture. Prevention is any measure intended to limit health-related risks. Okay, we have campaigns, vaccinations, and the rest. Okay, then any more, you can go ahead to research on it. Okay, so that is all for today's lecture. Make sure you watch the first one. This is the second lecture for the course Psychological Basis for Health Behavior and Change Process. Please do subscribe and click that notification bell so that you'll be notified of when I post the next one. Please do not confuse the lecture notes because all of them have their own themes. Okay, and always read the description box below to know which lecture is for which course. Okay, and also check the playlist that I am going to put in place so that you see all the lecture notes for each of your courses. Okay, so for the meantime, do take care and have a blessed day. See you in my next video. Bye.